Milind bhai, can you let me know who is the next?
Hi all. My name is Talegaonkar, and I'll be sharing experience of my wife Seema, who was a hypoxic stroke patient for since 14 years. And out of these 14 years, uh, the first 13 years were with the traditional physiotherapy and neurology and so on. And but the last 1.5 year, I've been associated with Vasa concept and taking the treatment of Vasa concept. So first, I will share my experience with the first 13 years. What have I learned, and uh, you know, what therapies had what kind of impact. And so first, advice by a neurologist to us was that there is no medicine for this. And let me just first share with you what happened really, what how she got into a hypoxic stroke. So Seema was admitted to a hospital for a normal cox infection around the lungs, and while the chest physician was inserting a ICD, she went into a cardiorespiratory arrest, and we don't know what transpired in the operation theater, but there must have been a gap between the time she had arrest versus resuscitated, and there's a uh, big damage to her brain, internal hypoxic brain damage. And after that, she had to be kept in the ICU for 3 weeks, almost in a comatose state, and no responses in that state. Uh, then, after some other complications, she was there overall 2 months. And then, as we were getting discharged from the hospital, there was one very notable observation by a doctor. They said this kind of damage is something that we don't know how long it'll take. It can take 15 years. So basically, there was no hope, not much hope from the doctors. So ironically, Seema had walked in herself to the hospital for just an infection around the lungs, but she came back on a stretcher with significant damage to the brain. Now, after she came back home, there were good improvements for the first 6 months, and so she could, get up from the bed, stand up, and so on. But after 6 months, her recovery just got stagnated, and that is where we ran into many problems. And so let me just describe to you her state. And Seema is a representative stroke patient, so this will be applicable for many such patients. So she didn't have much motor control abilities, not able to balance, no fine coordination, so she could not uh, stand up or walk on her own. uh, she could not wear her own clothes, could not take food. And so we were in a situation where we had two daughters, young daughters, but she could not cook anything for them, and that was quite frustrating for her. And you know that state went on. Then we went to a neurologist. They said the only hope is physiotherapy. So we went to the most advanced neuro rehabilitation center in Pune, and we took her there for 3 years. They had 2 hour regimen for every day. So they would go through manual physiotherapy, then treadmill, then electric stimulation or current to the right ankle. And that I wanted to mention that one of the problem at that state of Seema was that her right ankle was frozen, and she could not voluntarily move it. Therefore, she could not bear any weight on it. So they would give electric stimulation to that. And they had also a couple of large machines, which are like kind of cycling machines for the patients, and they had high-tech computers attached to them. So I knew that this is going to take time, so I was not asking them every week or something. But after every few months, I would ask them, what is the progress. And I was hoping that, being an engineer myself, I was hoping that the machine will give some data or some indication of what is happening. But absolutely no inputs from those machines as to whether there is any improvement at all in Seema or not. And then there was a final trigger when we decided to stop going to that advanced neuro rehabilitation center, and that was they were forcing her to walk on a treadmill with ropes attached from the ceiling, and that was quite terrifying. And I could see that she was freezing because of that, and I could not have any dialogue, meaningful dialogue with the physiotherapist as to what is the purpose, whether what she's going to get benefit. So we just stopped that. Uh, Now, after that, we were really, clueless what to do, and then there was some frustration building up. So our family members started suggesting that why not go to this doctor, that doctor, based on more of popularity than any specialization consideration. So we tried doctors in Ayurveda, homeopathy. Even there's an ancient therapy called Marma therapy, which is supposed to stimulate the nerves, and acupressure and whatnot. Of course, none of that worked. I was not worried so much about the time loss or money loss. The biggest impact, as I saw it later, was that it was on the Seema's psychology. Because for a patient, with every new doctor and every failed treatment, it is a shock for them, and every new disappointment adds to the anxiety or this thing uh, psychologically. So she, at that point, she started getting migraine attacks, and so she would get around about one or two attacks every week, and every time she gets attacked, it was extreme headache, and we would lose at least a day of any possible therapy. So moving on, we learned our lesson that doctor shopping is a bad thing to do. So that is one learning we learned. So we said, okay, let's give a serious shot to physiotherapy again. So then we found one physiotherapy center, which was again neuro specialized, but they didn't have any advanced machines. They did have give personal attention initially, so I could see what exactly they're doing at a high level, and then I could talk to them and understand what is the line of treatment. So what I observed was the physiotherapy was more passive and of course more on the weaker side, uh, and there was not much improvement visible. So in the assessment time, I would watch what they were doing. So what they would do is they would rate the strength of the muscles on a 1 to 5 scale. So something like -1 to 5 plus, something like that. I used to wonder, the problem is motor control and balancing, and how is rating strength of a muscle going to help Seema? Anyway, so I sort of said, let's they are the experts, so maybe they know something. So we carried on. What happened then was the physiotherapist kept changing after a year. I think they must have got tired. They didn't know where it is going. So new physiotherapists kept coming. They started forcing her to walk, and we felt that okay, maybe we should also make her walk. So we were also making her walk at home, and then Seema started falling. Okay, and it was more dangerous because this time she would fall forwards, and most of you know that brain patient doesn't have the reflex action needed to protect themselves. So she could not use her hands to protect her, and most of the time she landed on face. So I saw one. I remember one incident where I was sitting, and then she was in the kitchen trying to move on her own, and she fell directly on the kitchen platform's edge, nose hitting. I mean, the edge hitting the nose. So a lot of bleeding and fracture and pathetic sight. So I was like, what is happening? So then I tried to analyze, and then I'll just share with you what I could see. I'm not a medical professional, but I'm a science student, so I try to understand what's going on. So what used to happen is whenever we or any therapist used to hold Seema's finger, even one finger like this, she could walk with fair amount of confidence and balance and whatnot. The moment you leave that and she is completely independent, then what will happen is her right hand would go near the body, stiff. Her right leg will also go near the body. and the foot will curl inside. So I could see there's a reaction. If you leave or independent, there's a problem. And but then the physiotherapist kept doing it, and this, of course, I must mention, I wouldn't have figured this out myself. I was at that time I was watching also. Saw an interview by Dr. Raju Vasa madam, and I saw that uh, walking can be a problem, and there is a major mindset issue here. So this is something which I have understood. Thanks to Dr. Raju Vasa madam, who has been guiding me over the last 1.5 years. I've been guiding new patients and so on. So what I've understood the mindset is, people normally think that they equate recovery equal to walking. Now that may be true for other patients, but for a brain patient, many times the brain patients are not ready to even stand or maintain balance. They are not able to, like Seema was not able to get up from the ground if she fell. There were times when she fell and she was alone, and my daughter was stuck outside because she didn't know how to get up. So a patient who is not able to get up or stand on her own, you force her to walk or climb staircase. I later realized that it's a major issue. Anyway, as luck would have it, she fell again right in the physiotherapy center itself, and she fell on her face, and that was like uh, the time we had to stop everything. Parth, can you please bring up a few slides? So here we were all a happy family before the hypoxic brain injury, and let's move on. Okay, just stay on this slide. So this is just representative that with every new therapy, it later on I realized, and I look back, and I look at the videos. I have videos of walking videos, other videos from 2009, 10, 14, 19, and so on, and I can see that her walk actually became worse and worse. Her right hand started coming closer. Both hands started coming closer to the body. Her right legs started curling. Foot started curling, and she would land on the outer edge of the right foot. So that started happening as they started forcing her to walk. Okay, so much so about that. We stopped that physiotherapy. Then I will share with you the last learnings from the neurology department. So a couple of common uh, points came out from neurologists. One is that there is no medicine for this condition, hypoxic brain damage. There is no surgery, but there is also a pessimistic outlook. So indicating that neuroscience doesn't know if there is any solution to this. But there is another common statement I'm hearing I heard from these 4 neurologists. They said that if at all anybody has any hope to treat or get rehabilitate a neuro patient, it is the physiotherapist. So that is a positive note. And I just forgot one quick thing I mentioned. One of the neurologists gave a strong list of medicines, and my wife had a hope that out of this long list, maybe there'll be one magic pill which will solve this problem. So so she religiously took those strong medicines for 3 years, and we later on found out that they were all sort of palliative. They were making her sleep more. They were chemically reducing her anxiety and depression. So through all this falling and all that which I mentioned, by the time she had gone in depression, and this neurologist made her sleep more. So the combination of falls due to force for walking and a sluggish brain due to heavy medicines had a pretty bad impact, because she would sleep most of the time, not able to learn anything. Brain was in that kind of state.